need. And we're going to talk about those types, whether there's current infection or a previous infection. Do I need to meet some type of criteria for the testing? And who has the testing available? What type of testing they have available? How do I go about getting tested, whether it's a swab or blood test? And then what do the results mean? So having asked all those questions, anyone had exposure, know of someone that's been exposed, been sick already among the group?
No.
No, good.
I have a friend of mine that's brother-in-law passed from it, from Kenton, Hardin County.
Okay, all right. Well, I'm sorry to hear that. We've actually been pretty lucky in our area. If you look at the numbers overall, at this point, through the Maritan, we've done 835 tests, total positive 23, test results that are still out are 14, and the total negative is 798. So that's as far as the numbers for acute testing goes. So we really had a low percentage, and it's interesting to watch different areas. I live in Delaware, and so Delaware County, their numbers are much lower than, say, Franklin County. So on to a little bit about the coronavirus. Patients have had it, have developed fever, respiratory symptoms, cough, some difficulty breathing. Those have kind of been the main symptoms. There's been all kinds of other things reported. Diarrhea or GI symptoms being one of those. If we look back, you know, in hindsight's 2020, if we look back to patients we saw in January and February at the urgent care, we had a bunch of patients who we swore had the flu. And we tested them for strep and flu, and they were negative, but they were sick. Vast majority of them had flu symptoms and GI symptoms. So there's probably a fair number of those that were positive at that time and just haven't come back to do the antibody testing to prove that or disprove that. Other things that have been listed: loss of taste and smell, extreme fatigue, strange thing like COVID toes, where you're get cramping in your feet, just to name a few obscure things that have been listed. A large percentage, as we look back, of people that have been infected have had little or no symptoms. The percentages exactly, that's going to be yet to be determined. You know, the big thing with combating the virus was all the things that we did as far as social distancing, shutting down the economy, keeping people away from one another, all the social and behavioral changes. But the development and the implementing of the testing really was a big part of this. And it took a while to get the tests out. And as we talk about the tests, we'll talk a little bit more about that. You know, the tests need to be accurate. If you're going to do a test and you get a result back, you got to be fairly confident that if it's a yes, it's a yes, and if it's a no, it's a no. So that's important. The tests that we're doing, and the vast majority of tests, are not FDA approved or cleared. These tests have gotten an EUA, which is an emergency use authorization, from Secretary of Health and Human Services. It only is issued if certain criteria are met. That has to be that there's no adequate, approved, or available alternatives based on the scientific evidence available, and that the test is effective in detecting the virus or the antibodies. And that's where we differentiate the type of tests, whether we're looking for the virus itself, active infection, or we're looking for the antibodies telling us we've had the infection in the past. Looking at the different types of testing, there's short-term or rapid, or I would say acute testing. There's really no rapid test where you come in like a strep test and they run it through and you know in 5-10 minutes. The acute testing, or the relatively short-term testing, takes 2 to 4 hours. People that are sick and meet certain criteria of the upper respiratory infections and fevers will get the acute test. It's collected by a nasal swab, and it's quite invasive, to say the least. We say that we're going to be scratching their brain when we do that. Like I said, it's used for acute diagnosis. We're using it for preoperative testing. We want to make sure that anybody that's going in for a surgery or a procedure, that they don't have it because they may be compromised by whatever procedure they're having. Plus, they don't want to expose the entire medical staff that is taking care of them. It's also used for OB patients that are about to deliver. Again, there's been situations where people came in, they didn't have any symptoms at the time of delivery, and within 24 hours, they had symptoms, which means their family, all the medical care people that were around them, and the baby was exposed to the virus. So those tests, like I said, take about 2 to 4 hours to get done. The other type of test, long-term testing, is an antibody test. We're doing IgG antibody testing through the urgent care, through our lab. That can be ordered by coming in, being seen by one of us, and that be ordered, or people's primary care physician can order that and send them to the lab with an order for it. This test is testing for an antibody. There are 2 types of antibodies. There's IgM antibodies, which are immediate antibodies you build up within the first 10 to 14 days. And then you develop these long-term antibodies, which are the IgG antibodies. This is a blood draw. So it's collected through a blood draw. We send it to Quest Laboratories. They tell us it's 2 to 7 days to get back. And if people have, symptoms as well as wanting to be tested for previous, then we basically need to have them quarantine themselves, limit their exposures. So this test is a yes/no answer. It gives no indication of the level of immunity. That's something that's going to be determined, and that's also important with the vaccine that's being worked on, because we have to know that somebody has a certain level of immunity to make sure they're safe around other people. That level of immunity is going to be determined over time, like I said. And they're going to compare that level of immunity to the level of immunity that's achieved by the vaccine. Like I said, this is a long-term antibody. It indicates previous exposure, okay? Meaning you had it from 2 weeks ago up to as far as 3, 4, 5, 6 months ago. So that tells you that you've been exposed, whether you had symptoms or not. You have the virus and you've built up these antibodies. Because we don't know how much immunity is built up, the re-exposure or reinfection is still possible. These are all questions that we don't have answered, and over time are going to be answered. It should not be used. The antibody testing should not be used for the sole method of diagnosis and to exclude infection, because it is based on previous infection, not like the acute nasal swab that looks for active infection. Okay. One of the things we talk about is, if you get the test and you have a positive result, could it mean you had some other virus or another form of corona? And there are other forms of coronavirus. So a positive test may be due to a past infection with another type of coronavirus. A lot of the illnesses you saw on some of the cruise ships where people got intestinal bugs, those were coronaviruses of a different type. And so there is some crossover. A lot of questions that are yet to be answered in regards to this whole coronavirus, the testing, diagnosis, treatment, exposure. I just saw something yesterday. They're trying to decide whether you can be infected by particles that are on a surface or whether it has to be something else. They said yesterday, unlikely that it's going to be carried and kept on a surface for a period of time. You're unlikely to get it if you're outside. The situations where people are going to get it, where they're in close quarters, nursing homes, dorms, army barracks, cruise ships, aircraft carriers, things like that. So we're trying to kind of muddle our way through. The vaccine hopefully will be available the end of this year or the beginning of next year. I know there's a lot of companies that are out there racing to get it done. But again, it has to be accurate and it has to be reliable. Because I'm sure many of you have gotten the flu vaccine and still gotten the flu. It's a matter of making sure the strain is within the actual vaccine itself. So having said all of that, what I want to do is open up the questions that's going to maybe get a little more detail stimulated, and we'll go from there.
I have one. How accurate are the negative results?
The negative results, what we've seen with our testing, the 90 to 95% range, it tells you that if the test is negative, you probably have not been exposed. Myself and quite a bit of our staff thought that, having seen some of those people that we thought had the flu and didn't have the flu earlier on, may have been coronavirus patients, and we may have been exposed without symptoms. So everybody we've tested of our staff's been negative.
Thank you.
Well, I had open heart surgery 2 years ago, and it was about that same time that I started. It was a gradual losing of my smell and taste. So.
All right, yeah, I got that.
Yeah, I'm sure if that ago, but for about 2 years, if that was something that would be associated with this.
Well, you didn't hear all of it?
No, I didn't. I must have missed part of it.
Well, I in end of May 2 years ago, I had open heart surgery, and during that time, well, prior to, I suppose, I started losing my smell and taste, and it was a gradual thing. And you know, I had talked to Dr. Hood, and he said, "Well, it's one of those things," and he didn't. I'm sure he tested me for a temperature, but I haven't had any other symptoms. But I just wondered, with the losing of smell and taste, if that had any.
Yeah, that's one of the symptoms that have been reported. It hasn't been across the board. It's been in a small percentage of the patients. But like I said, it's been one of the things that people have said when they've had little or no other symptoms, that's one thing that has shown up.
Okay.
I have a question about, what does COVID-19 or COVID stand for something, or why is it called COVID-19?
It's just the coronavirus 2019. So they basically name it based on the year that it was supposedly discovered or came out. And it's just a shortened name for it. There's other names for some of the other viruses that have no other coronavirus: HKU1, NL63, OC43. I think most of the things with those have been origination, where they've come from. So,
which comes to my next question. We've all probably read or heard so many different things about the origin of this. Where, how, when. We know basically, of course, last year, but the how and where. Have we narrowed that down yet?
I mean, they haven't 100% narrowed it down. It likely came from a person that worked in the lab in Wuhan, China, and they got outside the lab and then they exposed people in the food market. They originally had said that it came from bats or some of the animals there, but there's been nothing to substantiate that. It makes more sense that, you know, they're working with these viruses within a lab. Somebody doesn't follow a protocol, and you know they are exposed, and then they accidentally give it to somebody else. If it's not contained, if there's not a protocol to track where that person has been, who they've been around, like we're doing now, then it just spreads like wildfire, and then there's no control. So it's been a very hush-hush thing from the beginning, and unfortunately, there wasn't a lot of communication between different governments. And whether you say it's a cover-up or whether they're basically trying to save face, I don't know.
Thank you. Which I know this is kind of a segue, but why would people be messing with diseases in the laboratory? New diseases, is it like for germ warfare or just studying?
A lot of it is experimentation for vaccines. They actually had when working on vaccines for coronaviruses 2-3 years ago. It didn't really pose a big threat, so the money wasn't directed towards it. So they basically just stopped working on a vaccine. If they had been working on that up to this point, and they can use the RNA from the current virus, then they would be able to develop the vaccines faster. You know, we have a template to build vaccines because we have the flu vaccine and all those other things, but you have to basically fine tune it to the DNA or the RNA of the virus itself.
Thank you.
Any other questions?
What is the latest about wearing a mask?
Oh, that's a good question. Basically, the one thing that's helped the most with trying to combat the virus is the social distancing, the wearing of masks, and keeping away individuals who either have advanced age, medical conditions, something that would make them more susceptible. So, you know, wearing the masks are important. Somebody asked with another talk, you know, you go out and you see all these people not wearing masks. What should we do? Well, I wear a mask not to protect myself. I wear a mask to protect everybody else, because I'm in a situation on a daily basis at the urgent care where I may come in contact with somebody. If I didn't know that until 2 weeks later, then I could expose however many people, you know, I've been around. I come home from work, I head directly to the shower, I make sure that I'm disinfecting myself before I expose my family even. So the things that we do are looking out for others, and number one thing is wearing that mask.
What about the effectiveness of like a cloth mask? I mean, I know there's not N95 masks for everybody in the country, but better than nothing, or?
Better than nothing. And as time has gone forward, you know, the question was, what exposes somebody? Is it a virus particle, or is it something more? What I've read lately, and more of the research shows that these virus particles are too small. They're not going to last on any surfaces. What really exposes people is a bigger respiratory droplet. So you're either in super close contact, you're coughing it out, you're sneezing it out. There was somebody that was in a choir that was singing loudly, so they're belting out their tunes. Those are the situations where you're going to get that. These cloth masks will hold in respiratory droplets. Now, you don't want to wear them day in and day out. You want to make sure that you're switching masks and washing them and making sure you're doing things to sterilize them, not necessarily sterilize them, but clean them. so that you're washing off your layers of respiratory droplets on a regular basis.
Thank you.
Other questions?
I have one coming in via Facebook.
Muted.
I have one coming in via Facebook from Mark
Okay.
Mitchell.
Question?
He's still typing.
Ah, the little wavy lines.
So
Well,
Mark's question is, if he goes to a store and people aren't wearing a mask, should he go in or should he just stay away from those people? Or how far away do you think you should stay?
I think the established 6-foot social distancing is the recommended distance. I think if you do that, again, you need to be in close enough contact, or the person has to be hacking or sneezing in your area or in your personal space to allow you to be exposed. You know, you go to these stores, whether it's Lowe's, Home Depot, Menards, Walmart, and I start counting the percentages as number of people. Unfortunately, we're in the 30% range, and I think that's a generous estimate sometimes, people wearing the masks. I don't know if they feel that it's not a problem, they're invincible, or what the issue is, but again, I go there to protect myself. I wear a mask. So I think if we as individuals that are leaders in the community are doing that, that may spur some of the other people to do it. Their questions?
Dave, did okay. I have one. It's you mentioned the vaccine. I imagine to get validated, to be able to inject that into people's bodies, it probably takes more time for the validation than it does even for the development of a vaccine, doesn't it? Or what's?
Yeah, that the proof that it's going to work takes the most time, and right now, you know, there are companies get this vaccine out. There's 2 or 3 companies.
Nope, you got muted.
Yeah, you got muted.
There you go. I think that it's going to be that they're going to have to do something like they did with the testing, where they give it an emergency use authorization, or the right to try act, where basically, just like people are doing now, they're volunteering to be tested, to be injected with the vaccine. They're going to have to do something that's outside the norm to get this out faster. They're not going to be able to wait through the entire process that the FDA and everybody usually follows. They're going to have to do something sooner.
I think this would be a good learning curve for us for if something worse comes through, learning to get these things sped up.
And from a medical standpoint, you know, like I said before, we have a number of vaccines that have been used. They've come out with a lot of the vaccines for shingles. They've come out with vaccines for the flu. We've had flu vaccine, and they've basically refined and honed it down over the years. That's a template to use for this vaccine. So it's just a matter of whether the immunity is going to be built up with what they're injecting into you. They're trying to come up with other technologies as well. There's a small patch that's being developed that basically has a bunch of little micro needles made of plastic that you basically put on like a Band-Aid, and it gives you multiple tiny bits of the vaccine. So they're trying to think of ways to get it out faster, get it out efficiently. But it's going to have to be under a kind of an emergency use authorization.
And would this be like the flu, a yearly vaccine, or would it be like some of your childhood vaccines and you don't see it again? Or do you know that yet?
We don't know that for sure, but the likelihood is that it's going to be more like the flu, being a respiratory virus, that you're going to have immunity for the season, and then you're going to, you need to get revaccinated. You know, they talk about herd immunity. People that have been exposed and either had symptoms or didn't have symptoms, they're part of the herd that now has some degree of immunity. If we add them to the vaccinated population, then we hope that we have enough people covered. And, you know, there's a lot of people out there that are anti-vaccine, and unfortunately, they're relying on everyone else to acquire herd immunity, which isn't, I guess, from my point of view, is somewhat selfish.
COVIDiots.
Other questions?
Question. After going to the grocery store, bringing the groceries home, of course, I always wash all my fruits and vegetables before putting them away. But my canned goods and the box goods, I've been wiping those down with antibacterial wipes before I even put them in the cupboard. Is that really necessary, or am I just going to a lot of work for nothing?
Again, that goes back to how it's transmitted, whether it's particles, and that's what it was initially thought, or whether it's big respiratory droplets. I think that that's probably a bit much. You know, people went as far as you have, and other people, they get an Amazon box, they leave it out on the porch for 2 days, they take it in their garage, they take stuff out, they wipe it all down. I mean, I think that's not practical sometimes, and I think it's probably a bit extra or more than you need to do. Any other questions?
Nothing else? Anybody? Okay.
Well, if you do have other questions, I'm at the urgent care quite often. I'm not every day, but almost every day. And feel free to shoot me an email or give us a call, and we'll answer questions. Myself or my providers can do that. We actually have had quite a few calls with patients that have had other symptoms saying, can I still come and see you guys? What are you doing for this? We screen everybody when they walk in. We act like everybody could have it. And I think we've done a good job. Obviously, nobody's tested positive of our staff in keeping our facility pretty sterile and pretty safe. So thanks again for allowing me the opportunity to speak, and hope everybody stays safe and healthy.
All right. Thank you.
Thank you.
Thank you.
Yeah, thank you for